There hasn't been much creative thinking when it comes to Medicare, and we do maintain it. I think it is a central part of Australia's democracy that we have this incredible Medicare system. But all we've seen Labor do is really up the funding for bulk billing, hoping that this does incentivise doctors and doctors' surgeries to bulk bill. Do we need to rethink the way that we do fund Medicare?
We definitely do. And in fact, both sides have now committed to that bulk billing incentive, and it was in the budget to come in November. But you're right that it lacks that overhaul and reform to really modernise Medicare to the needs of today and the future, and make sure that all Australians get a fair rebate, regardless of how long they need to spend with the GP, rather than just the tack on bulk billing incentives, which
Yeah.
of course have their place, particularly for our most vulnerable Australians. But there could have been some more clever thinking into the Medicare reforms.
What would you like to see?
So we would like to see a modernisation of those Medicare rebates, to expand the number of items or different consultation types available to GPs and patients when they're seeing their patients, to make sure that we're investing in those longer consultations. And I don't mean hours and hours, but even the fact that a 10-minute visit and a 19-minute visit, you get the same rebate back in your
Yeah.
pocket, despite it being double the time with the GP. So really improving those slightly longer consultations to make sure that you can get your health needs addressed, and spend that time you need.
Just back to the co-payment, and look, the coalition doesn't want to go anywhere near it, but do you think it would have been a fairer way for everyone to just to pay $5 to go see the doctor rather than, a lot of people paying a $40 or $60 gap fee?
Look, I think we're clearly past that point now.
Yeah.
2014 was more than a decade ago now.
Mm.
And as we've said, we're now seeing those out of pocket costs more than $40. So, what's important now is how do we address affordability and accessibility of general practice and our healthcare system more broadly? And we know that the real pinch point for patients is getting that comprehensive care.
Yeah.
And that's also what will reduce the pressure on our hospitals, which we're seeing under more strain than ever. We really need to do more in primary care to keep people out of hospitals, and make sure that our sickest patients can get care as quickly as they need.
And just finally, only because we need people like you who are experts in the field to really correct some of this scare campaign that we've seen. Anthony Albanese has said many times, and we heard it from Mark Butler yesterday, saying Peter Dutton's trying to Americanise the Australian system. Have you seen any evidence of that? One thing that is often repeated as well is this this survey that said Peter Dutton was voted worst health minister ever by doctors. From my understanding, that was a voluntary survey. It wasn't exactly academic. Is that correct?
That was a voluntary survey, but at the AMA, we will work with whoever is elected to government, and really keep that pressure on to make sure that our unique healthcare system here is protected. We're not like America, we're not like the UK. We have this brilliant balance of public and private care where people who can afford to contribute to their care do so, so that our most vulnerable are protected and can still get that excellent quality of care without an out-of-pocket cost. That's what we need to protect, and that's what we'll be fighting for as doctors, as the AMA, is to make sure that we can really protect the health of Australians going forward.
Thanks so much for your time, Danielle. I really appreciate it.
Thanks very much.